my name is Gracie Donaghy, and I'll be going over microbial infections, specifically Lyme disease. This is one of my favorite modules by far to go over this semester, which is why I chose it. So, I just wanted to first go over the beneficial roles of microbes. These are things that stood out for me throughout the whole entire semester, and that's why I just kind of wanted to include this, because they're things I didn't forget throughout the whole semester. So they're essentially everywhere. The world is made up of trillions and millions of microbes. There's roughly 10 trillion microbes or bacterial cells that make up a human microbiome, which is just insane. They play a large role in food. As we know, we just went over food microbiology. Without that healthy, like those cultures and that healthy bacteria and microbes, we wouldn't have those common foods we eat every single day, like yogurt, bread, I think beer, wine, vinegar, all those things we wouldn't have without those cultures and those organisms and microbes. So that was a really important thing to note, I feel like. Health properties. So they have a lot of healing properties. They control the amount of nourishment that is extracted from food, which is crazy. I would have never guessed that they control how much protein and nourishment we get from certain foods, but they do. Every living body needs microbes. No person can live without microbes. And we ingest about 1 million microbes in each gram of food, which, if you think about it, a gram is so small, so that's just crazy that in one tiny gram we need just millions of microbes. To go along with like the healing properties, they help immune system development and they help fight infection. So with fighting infection and helping healing properties, they help with like wound sites, like cuts and scratches and things like that. But they also help with you know, internal infections like diseases, sickness, illness, all those things, but they can also help with just, wounds. They determine how our bodies react to vaccines. This was one thing that really stood out for me from the beginning of the semester, because Young also talked about how cancer patients, their microbes determine how they react to their treatment, so like chemo, like they determine how their bodies react to those things. So that was wild. And we need healthy bacteria in our stomachs and our mouths. Our bodies rely on microbes more than we know. I honestly knew nothing about microbes coming into this class, so that's why all these facts are just mind-blowing to me. But we would be so sick without that healthy bacteria in our mouths and our stomachs. That's what keeps us well and helps fight infection. We join with our microbes right at birth, which is crazy. It just kind of shows like how important microbes are, the fact that we do join with them right at birth. So now we'll get into the not as great side of microorganisms and bacteria. So we have the common causative agents to skin infections. I just wanted to put these out here. They were on one of our quizzes, and they just show I wanted to do this because they show the different skin causative agents, skin infection causative agents, since Lyme disease is a skin infection. So we have Borrelia burgdorferi, which causes Lyme disease. Then we have VZV, which causes chickenpox and shingles. We have Rubella, which causes measles. And then Staphylococcus aureus, which causes impetigo. And then we have Rickettsia rickettsii, which causes Rocky Mountain spotted fever. One important thing to note is that the Lyme disease and the Rocky Mountain spotted fever are both tick-borne diseases. There are a lot of different types of tick-borne diseases, but I'd say Lyme disease is the most common one and most heard of one. So, Lyme disease is a bacterial disease that is transmitted to the human host from the original host, which are black-legged ticks. The larval and nymphal ticks can become infected with Lyme disease bacteria when feeding on an infected wildlife host. So I'd say, I mean, really, that is the original host. So really, I guess there would be at least 3 hosts involved in this, which I didn't catch when I wrote out my slides. But yeah, we have our wildlife host, and then the mosquito or the tick host, so sorry, and then the human host. So usually a rodent, that's where they get the bacteria from. The bacteria is then passed along to the next life stage, which we will be going over the next slide. Nymphs or adult females can then spread the bacteria during their next blood meal. So causative agents, like aka bacterium, include obviously Borrelia burgdorferi and Borrelia mayonnaise, I think is how you say it, which is not as likely in the United States, which is why I'll only be mentioning the Borrelia burgdorferi. So, near the life cycle of Lyme disease. So, there's 4 life stages. There's the egg, larva, nymph, and adult. So in the picture right here with the finger, you see there's this teeny tiny baby tick here and then like a little bigger one here. That teeny tiny one is so small, you're probably not going to spot that. Like when it's on your body, it's attached. It's going to be a while, probably till you tell it's on there. Because some ticks can be as small as poppy seeds. So you just gotta keep that in mind. They can be so small. I mean, it's almost microscopic. Like, it's so tiny. And then we have over here this little chart by the dime shows the larva, how teeny tiny it is, and then the nymph, the adult male, and the adult female. I thought it was really interesting that the adult female is way bigger than, or like a good amount bigger than the adult male. I would not have expected that. And then we have this chart. These 2 charts are from the CDC. And this one just kind of shows like the 4 seasons and then just like when you're most likely. So the risk of infection is in late spring and summer. So then it just, shows the kind of the stages. In order for the Lyme disease bacterium to be transmitted, the tick must be attached to the human host for at least 36 to 48 hours. So that's also kind of an important thing. If you get it off before, then you're probably in the clear. But if it is on for at least 36 hours or more than 48, you're way more likely to get the bacterium in your system. So the symptoms of Lyme disease. So, so 3 to 30 days after the tick bite, signs and symptoms may include, but are not limited to, fever, chills, headache, fatigue, muscle and joint aches, and swollen lymph nodes may occur in the absence of rash. It's kind of important to note that it is in the absence of rash, but these can also occur with the rash as well. So the EM rash, I'm not even going to try to pronounce it because I always say it wrong, on average will begin to be visible at the site of the bite 7 days after being infected. This is something that will be important later on just to remember. So it does take 7 days usually for the symptoms to appear or even the signs of this rash. So I have most of these pictures are from the CDC of these different types of rashes. So the one on the farthest left and then the other one, the 2 bullseye ones, start with a red area around the initial bite area, and it will begin to grow and the middle will begin to clear, which creates the ring on the outside. That's when it'll develop, and that's what creates that bullseye effect, like that look. These 2 other rashes are just a completely different version of the EM rash, but they are still an EM rash. So they can come different shapes, sizes, and all anywhere on your body. So symptoms of Lyme disease continued. So 2 common symptoms that can occur anywhere from days to months after infection include a swollen knee and or facial palsy. Along with that, there are these following possible symptoms. So there's stiffness in the neck and migraines, so really bad headache. Morium rashes. They can show up anywhere on your body. You can get multiple at a time. They might all look a little different. They'll be different, just everything. So that's one important thing to note. Arthritis. You can get arthritis from this. You can get discontinuous pain in muscles, joints, bones, and tendons. So pain that comes and goes in those places. Then we have Lyme carditis. Even without Lyme carditis, you'll probably have an irregular heartbeat. It's pretty common, but if it is on the higher severity, you might have Lyme carditis, which occurs when Lyme disease bacteria enters the tissues of the heart. It interferes with the normal movement of electrical signals from the heart's upper to lower chambers, which is where coordination of the beating of the heart happens, which can cause heart block. It's rare to have Lyme carditis from what I understand, but it is possible with Lyme disease. Dizziness and shortness of breath, and pain, tingling, or numbness in the hands or feet are also common things. And then one important thing to note about the facial palsy is the loss of muscle tone or droop on one or both sides of the face. So in this picture of the facial palsy, you can see it like gives you like face dysmorphia almost. It's really sad. I was looking at just like pictures of real people that have it, and it's just so sad. And then we have these pictures of the legs. So this is where, just like one of your legs swells up. I wanted to look at like a real life picture just to kind of see, and you can just see, it swelled her thigh, her knee is so swollen. And we're going to get into more about what that is and how it's treated in a second. So there is usually a two-step testing process which uses blood samples. It is common to test negative at first due to antibiotics. So the two-step testing process can use usually just one blood sample, and they'll test it. If it comes back negative, either you're negative or it came back you were tested too soon. So most Lyme disease tests are designed to detect antibodies made by the body in response to infection. So it takes about 7 days after infection for those antibodies to come into play, and that would show up on blood samples, which is why it's important to get tested again if you test negative. If you were around ticks and all of that stuff, it would make sense for you to have Lyme disease. So they can take multiple weeks to develop, not even just 7 days. So if tested right after infection, when it will likely be negative. Post-infection antibodies can stay in the blood for months or even years after infection. So even after you've been treated, it can still stay in your blood. Those antibodies will still be in your blood it could be up to years. So that's crazy. So treatment kind of varies depending on what you have. So if you have the EM rash, your treatment might look a little different than the other things. So for the EM rash, common drugs for that are doxycycline, or amoxicillin, or cefuroxamine. I never say it right, but for those, it kind of depends on your age, but you'll take it 2 to 3 times a day orally, and anywhere from 100 to 5 milligrams per day depending on the drug and your age. And the duration of time will probably be around 10 to 14 days And if symptoms still persist, you might have to go for a second round. And in children, those dosages are, of course, different. So, for the neurologic Lyme disease, so it involves the cranial nerves. It affects them. That causes the droop. It also messes with your central nervous system involvement. And that can cause fever, headache, sensitivity to light, or a stiff neck. So it's like one, I think, it's a pretty low percentage, I think, who have facial palsy. I can't remember exactly, but it is very possible to have facial palsy with Lyme disease. So that's treated kind of the same way, just with doxycycline and just other antibiotics. Yeah, and that's usually orally. Yeah. And if it doesn't persist, you'll probably have to go for a second round. And then Lyme carditis, which is when it gets into your heart tissues. So, it's treated with oral or IV, or IVs, depending on the severity. Some patients might need a temporary pacemaker, but generally patients can recover from that in 1 to 6 weeks. But yes, it can be fatal. Some of these symptoms are very fatal. It's really a horrible disease. And for the Lyme carditis, you'll have doxycycline, cycline, amoxicillin, cefoxamine. Yeah, that's the main things. And with Lyme arthritis, which is what causes that swelling in the knees, it's treated with a 4-week course of oral antibiotics. Patients with persistent joint inflammation and pain after the first course of antibiotics may require a second, as I said before. Yeah, I think that, yeah. So those are the main causes or main treatments for those 4 main symptoms. And then, of course, I mean, the more common symptoms that show up in more, like, most illnesses would be treated with, your normal, like, nausea medicine and things like that. But these are treated specifically for these symptoms that come from Lyme disease. So it's definitely not something to mess around with. It's just kind of definitely taught me I need to, like, check and really make sure if I've been outside or, like, hiking or something, to just really check, make sure I have no ticks, and to check your animals too, because they are on the ground right by those ticks. And yeah, it's scary to know that some ticks can carry this horrible disease. So yeah, this is my works cited. Thank you so much for watching.